Hello and a very warm welcome to our special webinar focused on building resilient digital healthcare ecosystem organized by Tech Observer magazine in association with VMware. I'm Ankush Kumar, editor of Tech Observer magazine. First of all, thank you so much for joining us today. We hope you and your family are staying healthy and safe. Prime Minister Narendra Modi recently inaugurated the Ayushman Bharat Digital Mission, which will offer everyone a digital health ID. The purpose is to develop a unified online platform through the provision of a wide range of data, information, and infrastructure services. Duly leveraging open, interoperable, standard-based digital systems while ensuring the security, confidentiality, and privacy of health-related personal information. The potential for an integrated platform for healthcare service delivery is enormous, as it can give trustworthy data resulting in improving treatment and cost saving for patients. However, digitally protecting healthcare data to enhancing the experience of doctors, hospitals, and healthcare service providers need a continued push by various stakeholders, including state and central governments, on leveraging modern applications, technology, and ensuring enterprise-grade security. To understand these new trends today, we will be joined by senior healthcare leaders and technology experts. To begin the program, I would like to invite Mr. Nilesh Goradia, pre-sales leader, systems engineering from VMware, India, to deliver his presentation. Over to you, Mr. Nilesh.
So thank you, Tech Observer team and Ankush for inviting me for this webinar. I am the technology leader with VMware, and I'll share my thoughts in terms of how do you build a resilient, and I've added one word, from my side, which is connected, right? Because it is very, very important that today's, healthcare framework, which we are trying to devise, is connected end to end. Right, and that is where I've added the word connected over here, a digital ecosystem in the new normal. Now, when we talk about that, there is a fundamental shift, right, from what we used to have before, right, from the patients to the clinical workers and the entire community as a whole, right. And as we face the pandemic, the first aspect is that I, as a patient or maybe somebody who is facing some sort of health issues, requires a constant monitoring, of what is happening to my health, right? So there was a survey which was conducted in April 2020, and at that point in time, we were just on the beginning of the pandemic itself, right? So I correct myself, it is not 2020, sorry, it's April 2021, where we were, 1 year down the line as far as the pandemic was concerned. And what was found is that, 82% of the patients, right, they constantly want to monitor their health conditions. And while they wanted to do that, it was not possible for them to, venture out, maybe due to lockdowns, or the restrictions which were there, or maybe due to their health conditions. So it was important that they get their health checks, their reports, everything available in a digital format, right? And they are able to even connect to some appliances and devices, where they could monitor their health, in remotely, right? So constant health monitoring was one of the things. The second one was 60% of the workers, even the clinical workers, the doctors, the hospital staff, and people who were supporting the healthcare system, they wanted to work remotely, right? And because maybe they were not able to visit, again, due to the lockdown aspects or various other aspects, but 61% of the clinical workers, they wanted to work in a hybrid format. The third is, again, April, whatever data is there were 661 million patients, which were basically vaccinated globally, right? And obviously the count is much more as of now, but Uh, Again, the vaccination format, the registration, the way people were having a communication as far as the vaccination was concerned, everything was changing drastically, right? So the community expectations also was very high, right? And cite to some examples of what we are doing with the COVID app in India. Okay, people require faster registrations to be done. People want to get their vaccination reports and so on. So this is what was required. So if you see, the entire aspect of healthcare is actually changing, right from the patients who want constant monitoring, the clinical workers, and then the community as a whole, right? And the pandemic has also shifted, the healthcare delivery priorities, and all of a sudden, digital has become the topmost priority for all the healthcare entities and organizations. So if you see what are the factors, right, which is driving these priorities from a digital perspective, the number one is how fast you can deliver those applications, right? And obviously, one example is the COVID app, the Arogya Setu app, which we are using in India, and it has been a reference and example for the entire world, with millions of people connected and using those applications, for their safety and also for the vaccination purpose. So how rapidly, you can deliver that framework, not only from the application perspective, but also in terms of, the infrastructure availability, because the scale which we are talking about, when we are talking from that application perspective is humongous, right? So if you think about India, a country of around 1.2 billion people, okay, the amount of load which that application has to take, okay, is very, very large scale, right? So it's about how fast I can develop that application, but it is not about developing, how fast I can deliver that application to the consumer as well, right? The second is, we also saw that, state governments and even the central government was taking a lot of initiative to bring up newer hospitals, to bring up, newer COVID care centers, where the patients can be taken care of. So there were a lot of new sites which were actually coming up, right? So even from a digital perspective, and even from the healthcare system perspective, these sites cannot be disconnected from the entire world, right? So how fast you can bring up that particular site, and not only that, what you can also do is how fast you can make that particular site connected. The third is, while the clinical workers and the doctors were working remotely, what kind of support they could provide while they were working from home, or while they were accessing the reports remotely, how fast they could get online and how fast they could actually get connected to the patients, okay, to provide them the right kind of services, right? So support for the remote clinical staff to provide them the digital services so that they can access the monitoring reports and also provide consultation, right, to the patients. The third is, immediate shift to a virtual care kind of a thing, rather than, everything being physical, the entire thing, availability, consultation, whether that could be done virtually. So while we were doing all of that, people who are actually applying the malpractices, definitely were not sitting idle. So they tried to, do whatever they could with their, evil intention. And there were also a lot of cyber attacks which were there, which were hampering these kind of services which were provided, right? So security is a very, very important aspect. While we speeden up the pace of delivering the right services to the patients, security becomes paramount, because there are people who want to disrupt that, right? So while we talk about the applications and the new sites and the virtual care, escalating cyber attacks was again a major concern which was there, right? So definitely pandemic has shifted, and I would say going digital, being virtual, supporting and taking care of the patients remotely has become new normal. And while we do that, also ensuring that the framework is secure is very, very important. And that is where, the MIT Technology Review, they said that because of the COVID-19, the entire shift of healthcare has moved towards digital transformation. And 89%, believe that, pandemic removed all the decades-long barriers which were there towards the digital transformation. And now we cannot think of a healthcare system which is without, the digital implementation. We cannot think of an healthcare system which is actually manual. We cannot think of an healthcare system which is not connected, right? So that is very, very important. And pandemic played a role where the entire shift moved towards digital. Some of the feedback which we have globally, okay, with some of the organizations, which is Nebraska Medicine, a primary healthcare organization in US, they said that, while we adopted the digital transformation, it helped us to provide the virtual interactions in a speedy manner with the admitted patients, right? Because they didn't have to wait, for the doctors. And for the doctors, it was also very, very important because they didn't have to go and connect to the patient physically, or maybe be near to the patient, right? And also saved on the PPE costs and, the medical equipment costs which were there and so on. So digitally connected has been found advantageous, by many, many organizations across the globe. And as we say that, it is a new normal, it is very, very important that it is connected in the real time, right? Because you will definitely not like lags. The care has to be provided based on the most recent reports which are there. The most latest condition of the patient needs to be analyzed and so on. So it is very, very important that while we create a digital framework, it is important that it is a secure, connected digital framework, right? Right from your point of care to your hospitals, the caregivers, the clinics, the diagnostics, special, departments like radiology, virtual care, right? And all your applications and the patient portal apps which are there and so on. So it is important that it is a securely connected digital framework which is available. So if you ask me, when I represent VMware, how can I contribute, right? Which people will ask me that as a technology OEM or a technology provider, while we do understand that what are the requirements, what can VMware, help you to do? So I would just start off by saying that VMware can help you to create a securely connected digital framework, okay, which can help you, to build a digital framework which can help right from your patients to the clinical workers or doctors and specialists who are working remotely, by giving you a platform which can help you to deliver a securely connected digital framework, right? And that is what is the promise, from VMware perspective. So we try to remove the barriers, okay, from a technology side, where, we saw that while we tried to create a new digital framework, most of the systems were very legacy. There was a huge security risk. They were very complex, to operate, not being supportive on the modern platform. And also, they were not seamlessly connected to each other, right? And that was a major technology barrier where, while either the apps are not modern to deliver, either on mobile devices or any kind of a device, or the infrastructure which is required to deliver that application is not the latest one, or it is not scalable in nature, so that you can host those applications on the infrastructure perspective, right? So those were the barriers. And as I said, my first promise to anybody who wants to partner with VMware ideally would be to remove those barriers and provide a securely connected digital framework, right? And that is what the promise which VMware brings to the table. And if I have to drill it down, we say that, okay, number one, we can help you to build any kind of an application. So if you want to develop the most modern applications like an Arogya Setu or maybe a COVID app, we have the right framework in place to help you develop those kind of applications which are either open source or with our Kubernetes framework, which is there, the modern applications platform which we provide. With that, you can actually, as a healthcare provider or a state organization, you can take an initiative to deliver an application, right? So you can leverage the VMware technologies to build any kind of application, and that application can be hosted on any cloud, okay, either any of the meaty empaneled clouds or any certified clouds which are there by Indian government or any of the hyperscalers which are there. There is no limitation on where you can host that particular application. So we do provide a resilient technology to be hosted on any kind of an infrastructure and any cloud. The third is there is no limitation on where that application can actually be ported. So might be you are using an Android phone or a laptop or a tablet or an iOS phone, you or even a rugged device or maybe a connected device which a healthcare worker might be using. The application is ready to be ported on any kind of a device which you can think of, right? So number one, the flexibility to build the application with the framework or modern application platform which is there. Number two, the flexibility to host that application on any kind of a cloud which you can think of. And third, while you have done that, provide the flexibility to securely access that particular application seamlessly on any kind of a device. And also provide the network framework, okay, which is very, very important. And that is where we said securely connected digital framework, right? So connectivity is very, very important. We also have the technology which can allow to deliver this application securely on any kind of network which you can think of. So whether it is a Wi-Fi or whether it is a connected network in the hospital, any kind of network which you can think of, we can deliver these applications on over the any kind of network, right? So any app, any device, and any cloud. And this is what VMware brings when you say securely connected digital framework, right? Any application, any device, and any cloud. So these are the areas of impact, right? So any application, whether you are developing an EMR or a telehealthcare application like an Arogya Setu or maybe a Coven, or there is a ready-made SaaS applications, right, which are available on the app stores, or you are developing applications using traditional models, we can help you to build those applications, right? And not only build those applications, you can host it on any kind of infrastructure, right? Whether it is your private cloud, whether it is your public cloud or edge. And edge is very, very important because you are talking about connected ecosystems. And when you talk about connected ecosystems, you know, in most of the times, it will not be available centrally. You will think of hundreds of locations, right, which want to connect, and you will want most of the information available locally. And that is where the edge comes into perspective, where you can start building those smaller clouds in maybe the hospitals or the COVID care centers or, you know, any other healthcare ecosystems where you start building those smaller clouds and then connect to the central private or public cloud. So edge is very, very important, and we can also help you to build those edge clouds which are basically remote, right? Not to forget, while you develop great applications and host it on, you know, resilient and scalable clouds, we can also help you to deliver those applications securely, okay, on any kind of a device which you can think of, right? So whether it is a tablet, whether it is an IoT, you know, kind of a device, you can actually have an application developed using the VMware modern application framework and then make it possible on an IoT device. Similarly, you know, your laptops or any other kind of users who are using that particular application, we have the promise to deliver applications on any kind of a device. While we say that, okay, the entire technology, and very, very responsibly, I would say that it is secure by design, right? So whether that is where we say that securely connected digital framework, it is secure by design. So every aspect has intrinsic security which is built in, rather than providing security which is bolted on. So what we are talking about is built-in security, security built in into each of these while you're developing the application, or while you're hosting it on any kind of a cloud, or while you're accessing on any kind of a device. The security frameworks, the security standards, the compliances, the governance, the risk formats which has been considered, that is all according to what the international healthcare standards are like. And HIPAA, for example, we adhere to those international standards. Now what I'll do is to make this more convincing for the healthcare adopters, I would like to narrate some of the use cases and case studies across the globe where we have worked along with those partners, and we were the technology partners with those healthcare partners, and we provided a solution to what they were actually looking at, right? So there are three critical outcomes which the VMware, I said, the securely connected digital framework drives. Number one is agility, right? Agility is to extend the reach of care very, very securely to make sure that your business, or rather than business, I would say the healthcare service, is up and running all the time. The availability is 100%, and it is accessible all the time, right? The second one is be more outcome driven, right? Where we can empower the clinical workers to be available online all the time and provide their services. And while they are available online, they should also have access to the latest reports, the latest information, the latest tools, and the latest applications to serve the patients which are there. The third is, we said that it is very, very important while you deliver the right services to have a security framework in place. And that is where the trust factor comes in, that when you connect remotely, do you have a protected healthcare brand and data? And while you are building that, even from a government perspective, it is important that the trust factor from a user aspect has to be there, and that is where the security framework comes into picture, right? So how do we do that, right? When we said I'll just go again to the slide, the agility, the outcome, and the trust, this is what we want to do. Now how will we do that as a technology provider? So number one, modernize your healthcare infrastructure and applications. So we provide a framework for the modern data centers and clouds by saying software defined everything, right? So VMware is a pioneer, and I would even go one step further, and we say that we are a de facto standard if you are talking about modern applications and the infrastructure which can host those modern applications, right? So if you are looking at building great applications require greater infrastructure, and that is where VMware comes into perspective, where gives you the right framework to build the applications and host it on a modern VMware data center framework, okay, which includes our compute, storage, and network managed by automatic operations to host those applications on the modern infrastructure, right? So number one, you have modern infrastructure, modern applications. The second one is, you speed up the delivery of your services, okay, by making sure that there is a right secure network, okay, being available to connect to the applications and the infrastructure, right? And that is where we play a role by providing you technologies like a software defined wide area network, right, which allows you to access your applications which you have developed and hosted on that infrastructure by using a software defined wide area network, which can allow you to connect to your applications from anywhere, right? We also provide something like a zero trust network access, which says that you can even work from home securely and then access the information which the patients require in a secure manner. The third is again correlated to what I said before, is connected networks and also providing those smaller cloud frameworks, okay, which you want to build towards the edge and manage it from a central place, right? So your remote hospitals, COVID care centers who cannot operate, without being digitally connected, and you want to have those smaller clouds being built on those COVID centers and the hospitals, we can provide you those smaller cloud frameworks to empower the edge which you have, right? The next is empower the scale and remote care of teams and staff. So you say that if you have a distributed workforce, how do you basically make them connected? By providing access to information. And that is where our workspace one and the digital workspace solution comes into picture, which allows you to access applications securely and seamlessly on any kind of a device. Not only that, it also allows you to manage, okay, that particular device from a central place and monitor what is going wrong as far as that particular device is concerned. Last but not the least is how do you have a secure access? And we have the framework right from the endpoint, where we talk about the endpoint EDR and the cloud security, and right to the data center, where we can make sure that the compliance frameworks are in place, whether it is in terms of governance, risk, or compliance, or implementing international standards like HIPAA across the endpoint, the data center, and the cloud. And we have our own EDR carbon black portfolio, which can basically make sure that the intrinsic security is delivered all across. So to have a look at some of the case studies, number one, operational excellence and reduce the cost through the data center standardization. Number two, build modern applications, right? Number three, enable the greater business and service continuity across the healthcare operations. So these are the three fundamental promises which we deliver, okay, by a technology which is known as a VMware Cloud Foundation, and the automated operations, right, through something known as a vRealize platform which we have, and build the modern applications by using our VMware Tanzu platform, which allows you to build the most modern applications. So step one, you will build the most modern applications by adopting the VMware Tanzu framework, and you will build a modern data center by using the VMware technologies. So we helped a global healthcare provider, okay, where there were 18,000 concurrent sessions, okay, being connected to that particular infrastructure by using the VMware technologies, and they were also using the VMware digital workspace so that the applications could be accessed anywhere, right? The second piece is regarding how do you enable the new care models, okay, for delivering those telehealth services. Now we do that by using something known as a software-defined WAN, and also providing secure network connectivity beyond the traditional boundaries by building smaller clouds and edge clouds, okay, on the remote locations. So you see that we work with Nebraska Medicine, which is again one of the major healthcare providers in the US, where we said that okay, people can get their own devices and enable the virtual care by using our software-defined WAN so that they can connect from any kind of a remote location, and also help them to build smaller edge kind of cloud so that they can be having the digital information, okay, on those remote edge locations, right? So again, it is SD-WAN, the smaller cloud, which is the VCF, which helps you to build those edge clouds, and then the digital workspace, which allows you to get your own devices. The third is improve the patient outcomes, right? Where you can deliver information on any kind of device which you can think of. So whether the patients are using their own devices or maybe the mobile phones, you want to deliver those applications and be interactive, and also check about the performance of those applications while the patients are accessing, right? So we have tools which can help you to do that, okay, which says that if the patients want to interact with you through those applications, you make sure that the network is either optimized and you are able to have a complete visibility, okay, of the application and the user experience of that particular patient while he is accessing that particular application itself, right? So when we talk about the MD Anderson Center, number one, we help them to be connected. Number two, the applications which they were running, okay, we made sure that those applications are giving the right kind of user experience and the patient experience. So we were able to monitor and also give a complete visibility into the application performance. The next is empower and scale, the remote care teams and staff. So again, while the workforce becomes more distributed, it is important that the teams and staffs, while they are working remotely, okay, are satisfied while they access the critical applications which are there. And again, the digital workspace which I've been talking is very prominent, where we were able to deliver the hospital and the healthcare application securely on any kind of devices to the employees who were working remotely. Then there is the intrinsic security piece which I talked about, right? Protect the healthcare data and patient trust. So when you talk about, number one, securing your infrastructure, which is either on the cloud or the data center, we can help you to do that. Secure your network, we can help you to do that, and also secure your endpoint, right? Which is again very important, because sometimes you'll see there are ransomware attacks, and most of the compromises happens on the endpoints itself. And also secure your entire compliances. So HIPAA is a standard. So most of the VMware technologies basically help you to adhere to that particular standard itself. So again, another customer, which is the Interfaith Medical Center, which helps you to protect the online patient portal. I talked about infrastructure security either in the data center or the cloud through our Carbon Black platform. And also from the endpoint perspective, you deploy the endpoint detection and response, a Carbon Black solution, which can help you to move or stop the entire lateral movement as far as the malware is concerned. So if you see what is our promise as VMware, why you should talk to VMware, is again summarizing the three parts, right? Agility, very important, where you should be able to scale up and deliver faster, and also not only deliver but develop applications faster. Number two, again, while that is done, you need to reach to the patients faster. And third, very important, is basically making that the entire thing is secure by design. Okay, the security is built in, and rather than it is bolted up. And we are also going to contribute more and more towards the future as well, where we'll contribute to the artificial intelligence, machine learning, maybe worker robots, so and the virtual reality, augmented reality. So you will hear more from VMware as far as the entire healthcare is concerned, right? And to summarize, why would somebody choose VMware as a platform of choice? Is number one, it's a cloud agnostic platform for digital transformation. So whatever be your choice of cloud, of infrastructure provider, our promise is that we will be able to help you to build, develop, and deliver applications on that kind of a cloud, right? Whatever is your choice. The second one is it's a single flexible platform. Okay, there are not I would say we don't have thousands of points or siloed solutions, to say the least, okay, to make it possible. It's a single flexible platform for infrastructure, applications, compute, networking, mobility, and security. So rather than looking at maybe thousands of silos or hundreds of silos, this is a single, again, I repeat the word, secure digital framework, which can help you to do everything right from developing, delivering, and securing and accessing these applications from anywhere. right? To add to that, we have thousands of resellers and partners who can deliver our solutions, and also the ecosystem partners, right? Which is very, very important to make sure almost more than 1,100 technology partners, okay, who are partners with VMware to deliver a joint solution, right? 20,000 resellers, right? And more than 4,000 service providers. So while you decide to partner with us, okay, the framework and the ecosystem which we have built is humongous, right? So you will never feel that, you know, the right kind of support is not available, the right kind of knowledge framework is not available while you decide to implement VMware, right? So that is what I had to convey. Thank you very much for inviting me, and thank you for your time. I hope this lays a foundation, okay, for you know, considering a secure digital you know, framework for healthcare. Again, to repeat, it's a secure, connected digital framework. Thank you very much.
Thank you, Mr. Nilesh, for sharing an insightful presentation and telling us how technology can improve the digital experience for doctors, patients, and healthcare stakeholders at large. Now we will move to the panel discussion. Today's topic of discussion is building a resilient digital healthcare ecosystem. And to lead the discussion, we have with us Dr. A. Sharif, Chairman, Telemedicine Faculty, AIMS, Delhi; Dr. Rajesh Harshvardhan, Director and Head, Hospital Administration, SGPGI, Lucknow; Dr. Shafqat Khan, OSD, Medical Education, Health Department, Government of UT of Jammu and Kashmir; Dr. K. Madan Gopal, Senior Consultant Health, Niti Aayog, Government of India; Dr. Jugal Kishore, Director Professor, HOD, VMMC and Safdarjung Hospital; Dr. Nidhi Shukla, Medical Officer, Public Service Commission, Government of Uttar Pradesh; and Mr. Prashant Chaudhary, Director, Government and Defense at VMware India, who would also be the moderator of the panel discussion. Over to you, Mr. Prashant.
Thanks, Ankush, and thank you, Dr. Sharif and Dr. Madan, for joining. I know you had to wait slightly longer than expected, but I think we had a insightful presentation from Nilesh. Taking the cue from there, obviously, I think we are all here talking about digital transformation, which is happening across health sector, and with also the recently inaugurated Ayushman Bharat Digital Platform by our Honorable Prime Minister. I think we're on the right track. Wherever we talk about digital transformation, obviously there'll be need of providing data into secure fashion, having the right set of right kind of platform, providing access to doctors and patients irrespective of the device they want to use. So maybe I think I can start with the first question which always comes to our mind is saying, what has been the experience during pandemic and how did I think you mitigate the challenge and what were the major learnings? So maybe I can go from the left side. I'll go to Dr. Madan and Dr. Sharif. I'll come back to you on this particular question. So Dr. Madan, your experiences during the pandemic and how were the challenges mitigated and some major learnings from there?
Okay, thank you, Prashant, for this opportunity and this question. Because, this question is usually asked by many of the people saying that what has been your experience of digital health during these pandemic times. But if you recall that when the country went for a lockdown, all the hospitals were not knowing what to do. And there were people who were having, because if you see the epidemic, other disease burden situation, we have people who require constant care, that is diabetic persons, the people with hypertension, people with other non-communicable disease, they require constant follow-up. When the lockdown situation came, there was a dilemma how to treat these patients. People were not willing to go to the hospital for even for small minor ailments. This was a dilemma was there, and the dilemma was further compounded with the orders by honorable courts, saying that if you are doing a WhatsApp consultation, teleconsultation, they are all illegal. Having said this, how to grapple with this problem? At Niti Aayog, we had that dual advantage. last year, before the NMC came into full operations, uh, uh, the member Niti Aayog was chairing the board of governors, which was made to run the MCI. This was an push opportunity, and we could at least partner with them and push for the telemedicine guidelines. Because telemedicine guidelines, when they were released, it has created an enabling environment for this teleconsultation, and we have seen that how the market has come up after this telemedicine thing. Otherwise, telemedicine and other things are restricted to government institution to institution discussions and that kind of thing. Now, further refinements and other things will happen. This is the major challenge which has happened, and it has enabled the home-based care because initially, when as we have matured as the pandemic progressed, and we have also matured as the pandemic progressed with our treatment protocols, our management of the people at the institution, management of the people at the home. Initially, it was only institution-based care. Then with the release of this telemedicine guideline, with our maturity in managing the patients at home level, and with the use of digital apps like your pulse oximeters and other things for remote monitoring of the patient, enabled by this telemedicine guidelines, remote monitoring of the patient for fever, the oxygen level saturations, you see that how we have been able to, even when the systems had overbeen during the months of April, May, we could manage this pandemic and we could sail through that. So this has been very encouraging experience. Now with the launch of this digital mission and other things, that will go to the new level of our understanding, and it is going to stay there. I will stop here now and I will take further questions as and when required. Okay,
thank you, Dr. Madan. And I think, as you said, I think that was the need of the hour actually, where you work with MCI and Dr. Sharif, you also being chairman of telemedicine facility. And I think a lot of it had to be implemented at AIIMS itself, I'm sure, to provide services to patients in uninterrupted fashion. So your views, sir.
Yeah, thank you, Prashant, and thank you, Dr. Madan Gopal, for actually laying down the introduction to what exactly happened with the lockdowns. So I think we were really caught unawares kind of thing. We didn't know what to do in the beginning, and suddenly all the OPDs have been closed. And the biggest problem was the follow-up patients, and then we had a lot of bookings for the OPD appointments. So immediately our administration has decided that we would convert all those in-person appointments to teleconsultation appointments of the follow-up patients. And there were apprehensions about addressing the new patients whom the doctors have never seen till then. So we took a proactive step only to address the issues of the follow-up patients. So many departments immediately started contacting their patients on the day of their appointments. So luckily for us, we had a stock of mobile phones, and we distributed 2 to 3 mobile phones for each of the department from which to call. So how we went about doing was, we immediately sent messages to all the patients that on the day of their appointment, they need not come to the hospital because of the lockdown, and a doctor would contact them on the day of their appointment. And the patients were waiting, and the doctors called one after the other. Now, whatever the list was being provided by us, the list of patients and their contact numbers was provided to the departments, and the departments contacted their patients, follow-up patients, and then they have given whatever possible advice could be given. And then if the patient was in need of medical attention, they were directed to reach the nearest hospital if it is a kind of some physical intervention or something is required. So this is how we could manage the follow-up patients. So and luckily for us, this telemedicine practice guidelines was released by Niti Aayog well in time. So, and that has given a lot of confidence, and immediately we started building up a doctor's dashboard whereby the patient's details were actually shown to the doctor on their desktop, and then they could actually they were follow-up patients, and some of our departments maintain physical records of the follow-up patients. So we were providing the list of patients a day in advance so that they can take out the physical records and have them in front of the doctor, and the doctor could talk to the patient and then do whatever is possible. So this is how we could manage the follow-up patients, and we could not do much to the new patients. So yeah. So and then I think it was I should appreciate, I mean, I really appreciate the timely this thing release of the telemedicine practice guidelines by the Niti Aayog. And the second thing we did was to help the general public, you know, the patients, the new patient. Then we started off again at the instance of Dr. Vinod Paul and Niti Aayog and the Ministry of Health. We started what is known as the teleconsultation, COVID-19 teleconsultation center at AIIMS. So we used to get a lot of calls to that, and then the calls were from the public mostly, and also from doctors who were managing the COVID-19 cases. So we had round-the-clock consultants who are experts in COVID management, who were helping those doctors who were managing the COVID cases in remote areas. So this we used to, you know, give the number of the doctor who has called us to the consultant. The consultant used to call them back and help them. So this is how we could manage. So most of the teleconsultation was on the phones, mobile phones. I think so. I think we should be happy that we had at least a functional mobile network, and then the registration requires a mobile number. Yeah, so that was one advantage. At least we had some means to contact the patients. So I think the major learnings were that we had to do with whatever we have. So tele-education was another thing. So all our students were homebound, and then we had to, you know, conduct the classes online. So somehow we managed to get some webcams and, you know, connect all the faculty members with the students, and then hurriedly use whatever software system is available to us, whether it is GoToMeeting or Zoom meeting or Microsoft Teams, whatever people could lay their hands on. So we continued our tele-education through that. So I think that the major learnings were we should be digitally ready, and we should be digitally enabled. And luckily for us, we have been in a better situation at AIIMS.
And I think, as you said, I think it was a starting point, and I think we were all getting geared up for this thing. And before I come to the technology side of it, as you said, I think at least we had telephone network which were functioning properly, and I think those could be leveraged. But I'm sure there is like much more expectation in terms of the platform which should be set and which provides seamless access to doctors and patients also, even not the old one, the new one. So, Dr. Shaukat, if you can hear me, I think before we move forward from some technology side of it, do you have some views over there?
If you look at the digital platform which has enabled us to fight Corona, I think this time we maybe have been doing much better than we would have expected maybe earlier. I mean, this was maybe we already were with a seamless connectivity across the country. We had good bandwidth available either with government or with private players. And we stood connected to every district, taluka, every, you know how remote areas we have. Our demography is very bad. We have very difficult to reach areas, mountainous terrain, and some of our districts are highly inaccessible, you know, some parts of the districts. But nevertheless, we, you know, took the challenge. Number one was to stay connected to the rest of the country, you know. So we were connected on the virtual platform, be it Ministry of Health, Government of India, the Health Minister, Government of India taking the meetings, or the CAB Secretary, or the various other officers who were taking, or the Health Secretary. And it was a continuous process. And then it became a routine. You know, today, if you look at our meetings, our Honorable LG takes meetings every day, 2 to 3 meetings. They are, you know, on web-based platforms. So my understanding is that what needs to be reinforced for our difficult terrain areas is the physical connectivity or bandwidth. Because you know, there are areas where the connectivity, the bandwidth issues are sometimes you know, in winters there are snowfalls, erosions, there are mountainous terrain, there is So I think a physical line connectivity is very important from that perspective. But if you look at the overall going from the connectivity issues to the software and to the user interface created, I think COVID has been such a marvelous, great victory for during vaccination. And today I was just on Twitter seeing that one of our districts has done 100%. We already have many districts who have crossed 100% vaccination, and within the coming month, we have set a target of the complete vaccination of the entire UT of J&K. So fighting it from infrastructural issues to vaccination today, it has been a great success. Nevertheless, I
Looks like we lost Mr. Shafkat. Dr. Shafkat, can you hear us? Okay,
highlight.
I think yeah, we can
Am I
hear you
audible?
now.
Sorry.
Sir. I think we
Hello.
lost you in between.
Am I
Yeah, we
audible?
can hear you now. We lost you in between.
Yeah. So I'm happy to inform you that. Hello. I'm happy to inform
Yes,
you
sir.
that our telemedicine network is also touching the very high right now, and we have been able to connect a lot of districts from the tertiary care centers to central hospitals through a network where e-Sanjeevani platform is working very great. We have teleconsultations going on, and I think we will be soon able to train our lot of paramedicals to have an interface between our telemedicine facility and the end user. We sometimes forget that we are in this area. When we talk about telemedicine, we are talking about live human beings who have physical problems. Sometimes they need to be auscultated physically, sometimes they need to be touched, felt, and not only that, they are being asked and examined by, say, a digital x-ray or a CT scan or a laboratory analysis or a ECG. But we may have to go one step down by having some robotic mechanisms which can maybe examine the patient also, maybe recording his temperature, recording his pulse, his the pain centers where the pain is initiated, which side of the body the pain is initiating. I mean, that is a little higher level of demand which I am putting forward.
And while I think Dr. Madan spoke about policy and how actually changes were done so quickly, Dr. Sharif spoke about, I think some of the data was available physically, but as Dr. Shafkat said, network connectivity is most important. And I think why the vaccination the drive has been very successful, because the cloud usage has been up to maximum actually. So if you look at when we today talk about multi-cloud scenario, that seems to have played a critical role actually during providing healthcare services during pandemic. So, sir, Madan sir, I'll come back to you. How do you really see technology-based maybe hospital information system which running maybe on multiple cloud? Because that is the need of the hour, I think, to provide access irrespective of what cloud the applications run. So, your views, sir, on this one.
Digital healthcare scenario in the country since 2013, efforts were being made. We are having multiple systems of information gathering, because information is to be used. Suppose I'm a person who is utilizing government services. My information would be collected with one program. If I'm taking the services of malaria program, I would be my details would be there. If I'm going to the TB program, my details would be there. So HIV program, that is there. For a hospital also, that softwares are there. That software for developing hospital information system, they are there. We are having an app called a Mera Aspatal app, which collects the patient feedback mechanism. the Center for Excellences like AIMS and names like institutions, they are having their own hospital information systems. But having said this, we need to have a structured hospital-based information system. When the PMJ was launched, so we have grappled to have a transaction software because it has migrated from RSVY. We quickly wanted this transaction software, and this transaction software would be talking to the hospital information system. If you go way back to the Clinical Establishment Act in 2010-11, when we had this, we enacted this Clinical Establishment Act, which mandated all the institutions, health institutions who are registered, to have an electronic health record. That's there. That's a part of the act. To facilitate that, the government of India, they have taken a license, COVID 3D license for all the institutions. Because, and CDEC was the nodal agency, CDEC Pune was the nodal agency for helping the hospital with the softwares and for coding of that information into a usable form through the use of the NOMAD series software. The license was there. Okay, having said this, you see that the uptake of this in the government institutions, you would be having a HMI kind of system which would be interconnected. They are having this. AIMS is having a system. The other institutions are also having a system. District also, but some system would be there. Whether it would be fragmented or not, some systems are there. But once it comes to the other providers, then there the challenges comes. Even if institution is collecting, if suppose a patient is registered in AIMS and he wants to go to some other place, he has to be referred to some other part of the country. The data systems, they don't talk to each other. Similarly, when the information system which we are having, I can cite the names of the program. We are having a hospital information system. We are having an online registration system. We are having Mera Hospital system. We are having our stage portal. So for integrating that thing, initially we started with the integrated health information platform, where all this software they can ride on this platform and they can talk to each other through a common identifier. When this PMJ started, we also started to think about having a digital ecosystem. So you might have seen that initially we came up with a national health stack. Stack means a repository of all the information, which led to the formation of a which fitted into a national digital blueprint. And national digital blueprint gave an architecture for the digital reforms in the country, and some of the activities have been rolled out in the form of a national digital health mission, where essentially we are trying to create an electronic health record. We are trying to give an ID to the institutions. We are trying to give an ID to this. If all the things are coming together and with the proper hospital information system, if everybody is using, every hospital is having an ID, if it's using a standardized kind of data structure, all the systems can talk to each other in the coming time. And the cloud-based technologies which will be coming up in the coming years, you will be seeing more of this kind of thing. But it's still evolving. And once the things are evolving, you see the journey of the telemedicine in the country. Early 2000 we have started. Now you are now seeing it takes time for evolve any technology. Initially, whenever you are trying to, unless these technologies are brought into the system, into the mainstream system, and the mainstream endorses the system, it is very difficult to have this, because we follow the same system of that you generate evidence with the use of a technology. Then we will adopt. Otherwise, if I am not adopting, I am not going to generate evidence. So this vicious cycle goes on. We have to have a different approach for validating this kind of technologies. We are having a lot of hospital information systems. If you look at the PMJ 2.0 version, that means any of the hospitals, they can use that software for treating the patient. All the insurance companies can do transaction based on this system. That kind of ease has been given by this. We are moving in that direction. If you look at the adoption of the technology, you see we were having a even platform, that is electronic vaccine inventory intelligence system was there, which was adopted and which was upgraded to a COVID platform. And you see the beauty of that we are managing such a huge database, and the ease at which the planning of the sessions have happened, we could plan 1.5 lakh sessions a day, more than that. Otherwise, manually doing that thing is very difficult. Every other day in the week. So that's why this becomes very important in the coming days. And as we are evolving, as we are maturing, you will be seeing more and more beauties of all these technologies which we are using. But nevertheless, having said this, we have to see that how we balance the adoption of this technology to create evidence, how to bring practice into this technology, not the vice versa. Technology into practice is very difficult. You can bring practice into technology, and that would be accepted by all the medical professionals. That's the balance which you have to.
Very well said, Dr. Madan. And I think you also highlighted before I just come to Dr. Sharif. So I think obviously there is a challenge of some of the systems are still fragmented and maybe not that entire data can be. That's the need of the hour. As Dr. Madan said, I think we are on that journey now. I think it's just a near future. I think we'll be able to do. So, Dr. Sharif, your view from AIIMS perspective on maybe technology-based HIMS systems.
Thank you, Prashant. As Dr. Madan has pointed out, it is essential that every healthcare organization or institution which is providing healthcare should have an information management system. So that is the bottom line. So there is no second opinion about that. So now I would like to talk about the systems that we have in place and the systems which we are envisioning with our journey towards a world-class healthcare university, which that is AIIMS is in the process of redevelopment. I think you must be aware now. So now what we are planning to have. So I'll just talk in these two parts. What we have is the NIC's e-hospital, which has been working in the AIIMS for the past decade or so. So, and we also use the ORS that Dr. Madan has referred to just now, online registration systems. So patients can take appointments to the OPDs, etc., on the online registration system, and then all their demographic data and everything is available in the NIC's e-hospital. And apart from that, we also have so many applications which are developed in-house for various purposes for various departments. So now we are using the data from the NIC e-hospital in those other applications. That means our applications are also talking to the NIC e-hospital. So now this is the situation right now. And then we have a PACS system. There are multiple PACS systems in the institute. Every department uses a different kind, GE PACS and Siemens PACS and all those things. And we also have an open PACS system where the images and reports from all these other multiple types of PACS systems are pooled into one. So I think now what is important is that interoperability and flow of data between the applications, that becomes important, either within the institute or between the institutions. So I think we are in the right direction with the NDHB, that National Digital Health Blueprint and the National Digital Health Ecosystem. So we are in the right direction, and I really appreciate the government actually providing a means to make applications interoperable, because it is impossible to force all the organizations to have similar applications or whatever kind of thing. They can have whatever kind of software they like, but that software should be able to talk in a standardized way with all other softwares.
Got it.
So
I think Dr. Sharif, so I think and you said I'll come back to you. I think we have Dr. Nidhi who joined us from Government of UP, and I think we can just hear from Dr. Nidhi also. And Dr. Nidhi, I think you've been hearing Dr. Madan and Dr. Sharif in terms of the challenges which are currently there. While the systems are in place, but I think there is a lot of work need to be done as well. And so, Dr. Nidhi, your views, please.
Sorry, as our doctors are saying, and technical, I think these are very helpful in rural areas, but main issue is hello, I'm audible. Yeah.
Yes, ma'am.
Okay.
If you can be slightly louder, I think that Dr. Madan, we obviously, I think initial part of conversation we spoke about in terms of the systems and everything, and now I think it's a great news 2 years in terms of when we heard about obviously Ayushman Bharat Digital Mission, which has been launched, and I think that obviously hinges on platformization as well as the modern applications which will be developed around this, because Dr. Sharif also mentioned some of the points saying that interoperability, single platform, data communication from one application to another. I'm sure security will be one concern. We'll talk about it later. But your views are how will it help us with the new digital plan which has been launched? Dr. Madan.
Prashant, can you come again with a question, because
Yeah,
the
so
last
I'm
part.
saying that. So your views, sir, will the Ayushman Bharat Digital Mission, and I think we spoke some of the challenges with fragmented system. There is a need of having a standard data communication between multiple application interoperability. Do you believe that this platform, once this platform comes, will be take care of most of these challenges? So your views on this?
As I mentioned, Prashant, so many softwares were there. So work for integrating all this platform has already begun. And now the onboarding of the platforms is happening. If you look at the integrated health information platform, which is been catered by the Ministry of Health and Family Welfare, it has already onboarded the integrated disease service program, and as far as the health information management information system. Now, slowly and slowly, other programs would be coming to this platform, including the this PMJ platform. But the digital mission that you have made, it's a mission board to create electronic health record, digitalize the IDs of the people, so that a common identifier is there across all the programs to talk to each other. As Dr. Sharif has mentioned, unless the programs have a common identifier, they can't be talking to each other. If a hospital ID is there, but the security and other elements, if you talk about that act is also been considered, that I'm not the expert in that legal aspect, but the METI and the ministry, the ministry which is handling that kind of data, they are the guardians and the responsible people for this, and the act would be taking care of that, the security issue. But nevertheless, we have been talking about the intent is already there. If you look at the national health policy of 2017, that mandates that we will be having a digital ecosystem, and moving in that direction. From the health stack, we are having a digital blueprint, then the digital mission, which enables us to have an electronic health record for 1.3 billion population. Similarly, on the lines of this, if you look at the way the digital, even electronic health record, or this patient ID, if you have used Aadhaar and other based kind of thing in the COVID app, so some reference ID would be there, and that can be used for seeing the electronic health records and other things. That kind of thing might be happening. But nevertheless, work has already been progressed for integrating all this platform through a common identifier, which would be a common identifier in the form of a patient health record, patient ID. That would be talking to this. Suppose if I have availed a service using that ID for malaria. Initially, everybody, when the COVID came, everybody said that India is having a lot of BCG vaccination. About BCG vaccination, every other person is having BCG vaccination. But where is the data? That program, immunization data, and the COVID data, where is the common identifier? Now, in the coming years, you will see that if somebody has access something, if I want to triangulate and use that data and analyze that, how many of the people, at least it gives a broad sense, and some research questions can be framed, and it can take to the further analysis can happen. It is moving in that direction.
Sure. Thank you, Dr. Madan. I think we have Dr. Nidhi back with us. And Dr. Nidhi, sorry we lost you in between. I think coming back to you, would you like to add something in terms of the hospital information management system, and as Dr. Madan said, how the direction it's moving, where we will have a platform which will be able to have various applications will be able to talk to each other. Dr. Nidhi, over to you. Can you hear us, Dr. Nidhi?
If you can unmute yourself, Dr. Nidhi.
We can hear you now, Dr. Nidhi. You can.
हेलो एवरीवन, जैसा कि अभी आप लोगों ने बताया कि टेक्निकल इश्यूज काफ़ी होते हैं। जो भी गवर्नमेंट की स्कीम चलाई गई है उसमें ये चीज़ बहुत अच्छी है कि पेशेंट टू पेशेंट हम लोग काफ़ी हेल्प कर रहे हैं। आयुष्मान भारत है, आरोग्य सेतु है, जैसे कि आप लोग बता रहे हैं कि बहुत हेल्पिंग है। बट मेन क्या होता है कि ये नेटवर्क इशू की वजह से यहाँ
I think looks like, and I think that's need of the hour. I think to have better network, as Dr. Kat also said, irrespective of the terrain. So looks like so. I think Dr. Sharif, I'll come back to you while Dr. Madan has laid out the guidelines for the new platform, and I think it's just down the line right now. I know, I think none of us may be that security expert, but I'll still like to have your views, because once you have an application in place which can actually fetch data from various applications, which means somebody who with the right ID of a patient, he'll be able to see all the information. So there'll always be concern about data privacy, and then your views on digitally actually protecting healthcare data while leveraging modern applications and technologies. So do you feel that can be done, or some of your views on this point, sir?
Mr. Prashant, are you asking me?
Yes, sir. Sir, I thought I'll come back to you before I go back to Dr. Madan in terms of because you are on ground, and I'll say that you will have to make sure the systems work.
Yeah. I have some thoughts to share with you, because I have been closely following. I'm also heading the IT division of AIIMS. So I have been closely following the National Digital Health Blueprint and the National Digital Health Ecosystem, and now the Prime Minister's Ayushman Bharat Digital Mission. In fact, I should tell you, I am very happy that this has been happening, and this will provide the glue to all the multifarious systems in the country, whereby if they follow the standards and the advice given by the National Digital Health Ecosystem, all the systems will be able to talk to each other. In fact, the National Digital Health Ecosystem has provided a sandbox which actually can be used while developing or implementing the various different kinds of healthcare information systems. Now, if you make sure that your healthcare information system is able to talk to the sandbox using APIs, then you can be sure that your system will talk to any system which follows the standards. And all the standards which are recommended are national standards, whether it is standards which are national electronic health record standards of 2016, or SNOMED CT, FHIR, or HL7. All the national, international standards have been implemented in that sandbox. And if we are able to talk to the sandbox, your application will be able to talk to any other application which follows the same standards. And that who is the biggest beneficiary of this? The patient. If a patient goes to one hospital and his digital health is there in his EHR, he can go to any other hospital and fetch his data from the other institution. Where suppose he comes to AIIMS Delhi today and tomorrow he goes to some other institution, let us say in Trivandrum, he will be able to fetch the data. Now, security concerns have also been addressed. Now, consent management system is recommended. Like, no one will be able to access a patient's data without his or her consent. And how can we ensure that? Now, if a patient goes to a third party and we have that patient's information in AIIMS, now the doctor who is attending to him now will actually send a request to the AIIMS healthcare information system through the APIs which are recommended and which are recommended by the NDHE system. And now we get the request from the doctor's healthcare system, and then we send an OTP to the patient. And if that OTP is given to the doctor and he feeds it into his computer, then only he will be able to see that particular patient's information. So this is one of the ways where we are thinking that we would manage the consent system and the security. So there need not be unnecessary fears that healthcare information can be seen by anybody who has the unique identifier of the patient. So it can be very easily managed, and only thing is any diverse application will be able to talk to each other if they follow all the standards and if they use the APIs as recommended by the National Digital Health Ecosystem. I think we are actually moving in that direction. With the redevelopment of AIMS, we are hopeful that we will have a system which will become a kind of a prototype for the rest of the country to follow. And we will try to stick to all the standards which are recommended by the National Digital Health Ecosystem.
Thanks, Dr. Sharif. And I think it gives a comfort even to the patient when you know that the right person is accessing. But Dr. Madan, I am sure, I think there were a lot of discussion, debate must have been done around security when you provide this kind of a interoperability and data multiple application talking to each other where data is exposed and API communication happening. So while maybe I think I leave it to you in terms of how much of depth you want to get into, but I think if at your level, if you give a high level view of, will definitely give us a lot of visibility that how this platform is becoming very secure. So Dr. Madan, your view.
I think Dr. Sharif has already answered this thing, the consent managers and the other thing. And in the act which would be coming, that is addressing these issues. I can only share at this moment this much only. Thank you very much.
No problem. And I think so. Last one, and Dr. Madan, maybe while I think Dr. Sharif is head of IT department, also this will be relevant for him. But from Niti Aayog perspective, especially maybe from a health side of it, what are the key IT focuses that will remain for next 6 to 9 months? So that will be my last question to you, sir. Some of the new initiatives or similarly in the same guidelines. So will that remain the focus, or there are some new things coming up from an IT perspective?
First and foremost challenge is to see that how this mission is completed. We are just pushing that the mission should be in a vision and warlike mode. It cannot be that basis. We are just pushing that you just do it in a mission mode. We are just after everybody saying that it has to be done in a mission. Vision in mission. So that's the first priority. Then the next priority is how to see that there are other data sources also available. Apart from health, there are other data sources also. At our level, the data vertical, they are just looking at seeing that how the data of other ministries, they are triangulated and some intelligence is brought out. Work is going on in that direction. The other vertical is looking after. I will stop here.
Dr. You wanted to add something.
Yeah. I know for Dr. Madan, I have a small request to make. See, there is a very nice sandbox on the National Digital Health, that is Ayushman Bharat's portal. Now, if you can give a kind of a certification to any software system that may be developed by any healthcare institution or IT institution, if it is fully compliant with this particular sandbox, and that will be an incentive, for them to go and install it in multiple places. They can say that yes, we are fully compliant with the National Digital Health Ecosystem. So I think you should think of that, because you are now leaving it for voluntary compliance with that. If you can say that we certify that if you are fully compliant with this, because that full compliance will ensure that there is a total interoperability, and then the EHR will be fully portable across all systems. And this is one small thing I have a suggestion to make. So that will be a very nice thing for any software developer or healthcare institution to claim that the hospital information system that they are using is fully compliant with the NDHE recommendations. I think this is one thing that I have not found. It was missing.
Okay, thank you. I have taken a note of this. But my experience of working with this kind of systems is that initially all innovation, all this kind of software development, it has to be done on a voluntary basis. The moment some comfort level is reached, and one or two people, the entrepreneurs, if they come forward saying that I have done this and met the standards, that gives a motivation to the other people to come up to that level. Then we can slowly and slowly build specifications and say that now you are meeting this standard, now you can go ahead. Initially, all the things begins in a voluntary mode, and slowly we have taken a note of this. I will just pass it on to my colleagues at NHA who are handling this distribution. See that how it comes up. It's a good.
Thank you.
Over to you, Prashantji. Any other thing before we?
No, sir. I think we are almost on time, and thanks a lot. This was, I think, really insightful to all the listener in terms of what is the transformation happening across health sector and how technology will play a crucial role. So, Ankush, over to you if you want to quickly do the ending note, and I think we can take.
Thank you, all of you, for being a wonderful panelists and sharing your valuable views and insights on how we can create a resilient digital ecosystem for healthcare delivery. We have now completely exhausted our time. So on behalf of Tech Observer Magazine and VMware, I would like to say thank you to all the speakers and attendees for taking out their valuable time for today's program. Hope the discussion was fruitful for you. Shortly, you will receive a survey form. Please do fill and share your feedback. We look forward to host you again. Thank you so much.
Thank you. Thank you.